Early in the morning of January 27, 2013, fire broke out in a nightclub in Santa Maria, Brazil, with as many as 2,000 people inside, most of them college students. Fireworks ignited by band members started the fire. 242 people died trying to escape. Another 100 were injured, and they overwhelmed the local hospital. In Sao Paulo, the Albert Einstein Hospital answered the call for help. It flew a carry-on-sized case, GlobalMed's Transportable Exam Station, to Santa Maria that would allow the physicians treating survivors to consult with specialists.
I started to work with telemedicine a few months before the nightclub fire in Santa Maria. When I became aware of what had just taken place, I made myself available to assist in the case. The fire happened on Saturday, and Monday morning I was already in Santa Maria.
We provided support to the local university hospital in Santa Maria, leaving the doctor round the clock with the GlobalMed telemedicine system available to connect to many medical professionals and specialists. What we really do in telemedicine is to transfer knowledge via technology.
We were able to connect Santa Maria directly to Albert Einstein Hospital and various places around the world. United States, Iraq, Japan, various specialists that had prior experience in handling similar cases with fire, and specifically fire in nightclubs. The KISS nightclub ceiling was covered with a thick foam that released a toxic, cyanide-filled smoke that many of the young crowd present inhaled this smoke. The precise treatment was only possible via the use of telemedicine.
Meanwhile, in northern Chile, GlobalMed's Transportable Exam Station proved important after heavy and sustained rains in the Andes, the worst in 80 years, caused flash flooding and mudslides, killing dozens of people. It is normally one of the driest regions on Earth. This amateur video shows the floodwaters as they flowed through the town of Chañaral in the Atacama region. The water rushed down the mountains, carrying with it buildings, large trucks, and cars. Chilean officials say the flooding has affected some 30,000 people. The nation's Minister of Health went to Copiapó to assure residents that the country will provide the proper relief funding. While there, she used GlobalMed's Transportable Exam Station and said the government plans to station them in locations around Chile.
Venir a ver cómo está funcionando la red de aquí de la provincia de Huasco y ver cómo está trabajando, dado de que en estos momentos sabemos que Copiapó está derivando pacientes acá al hospital de Vallenar. Queríamos ver en terreno cómo estaba funcionando, ver el hospital en terreno, si había sufrido algún daño. Hemos podido visitar muchas de las distintas áreas donde se hospitalizan los pacientes, con una calidad enorme de cómo está estructurado el espacio y también con la dedicación que se ve de su personal. Es muy importante el verlo en terreno y poder detectar las necesidades que hubieran para poder mejorar en caso de que este hospital, siendo de descarga, requiriera más dotación de personal por ahora, en la medida que Copiapó está derivando a los pacientes.
También está el tema de la telemedicina que lo acaban de mostrar, hacer una prueba. ¿Esto qué va a significar para esta red?
Bueno, un enorme apoyo, especialmente para preferenciar realmente el paciente que él requiere la atención de especialistas, dado de que esta telemedicina se conecta de médicos generales a una especialidad específica y determina si requiere o no alguna indicación precisa de su problema de salud. Esto está a la espalda mía en este momento el equipo, lo están probando, pero va a significar una enorme ayuda, especialmente cuando no contamos con especialistas a nivel del norte o del sur de nuestro país especialmente.
GlobalMed is committed to providing access to health care, even following disasters. For GlobalMed, I'm Roger Downey.